Today we are going to assess trunk lumbar flexion within the lumbar spine. In order to do so, we're going to use a tool called the inclinometer to gauge the amount of degrees that we get flexing our foot or our trunk forward. We're going to use George as an example here to produce this motion as if he's picking an object off the ground.
To take these measurements correctly, we have to find our bony landmarks first. So what we'll be looking for is initially finding the PSIS, which are these both right here, kind of moving medial, to find that S2. And now from that S2, we'll be going up 15 centimeters, which will roughly put us at about T12. And then that.
We're going to first find the PSIS within George's pelvis. We're going to then come medially to find S2. We're going to mark that down with a piece of tape, and that's going to be our first mark or landmark for our inclinometer. Keep going. We're then going to come up 15 centimeters anteriorly to find the next landmark for our inclinometer, and then we're going to use another piece of tape to mark that down.
So once we have our landmarks set, we're going to actually have a patient perform the activity, which is trunk flexion. All right, so Thomas, can you bend your trunk forward so you have your whole body coming towards the floor? So as you see here, the one inclinometer that's on his S2 is at 70, so that means that his hamstrings are probably compensating for some movement. So what we're going to do here is just going to subtract the numbers we have here. So we have 120 and we have 70. So we're going to subtract those, it'll be 50 degrees of trunk flexion.
Hey guys, today we're going to be testing the muscle strength of the internal and external obliques. In order to do that, we're going to be doing the manual muscle test for trunk flexion and rotation.
So the external oblique is our muscle that helps us side bend and rotate to the opposite side. So today we'll be looking at our patient's right external, and at the same time we'll be looking at the left internal, which is side bend and rotate to the same side.
Okay.
To perform this test, we'll have our patient supine, and we will ask the patient to perform the action so we can palpate the muscles on either side, the internal and external obliques. So Michelle, whenever you are ready, if you can flex your trunk and then rotate toward the wall, I'm just going to palpate those muscles. Very good. This test has a scoring system based on 0 to 5. 5 being the most difficult, so that is where we start. So in order to assess a 5, we'll have our patient interlock their fingers behind their head and perform the same motion as when we palpated. Michelle, if you could flex and rotate to the opposite side toward the wall. And what we're looking for is the inferior angle of the scapula coming off the table. And relax. So if our patient was not able to perform a 5, we would then move to 4, which we'll have Michelle demonstrate. You would cross your arms across your chest, and again, you would perform the same action, flex the trunk, and rotate toward the wall, still looking for the inferior angle of the scapula to come off the table. If it did this time, she would receive a 4. If not, you can relax, Michelle. We would come and try for a 3. So to perform a 3, arms will now be at the side. And again, we would have her flex her trunk and rotate toward the wall. Again, looking for the inferior angle of the scapula. If it were unable to come up all the way, but partially, then that would be a 2. If she were unable to perform that, we would ask the patient to cough, just to see if we could detect some movement or activation of muscle. If there were not, then she would receive a 0 for no action at all.
here's a little choreography to help you remember the manual muscle testing grades. Ready? Okay. 5, 4, 3, 2,